Go ahead and start with our second panelist.
Thank you. So Dr. Beltran, take it away.
Oh, I'm unmuted, sorry. Okay, there you go. Hello, can people hear me?
Yep.
Okay. Okay. Hi, everybody. My name is Raiza. I am a postdoc fellow here at UCLA. I'm also a T32 fellow under the Global Health HIV Prevention Fellowship. And I have a co-author with me and co-partner, Ashley Schuyler, who can introduce herself. So.
Yes, hi, I'm Ashley Schuyler. I'm a PhD student at Oregon State University in the College of Public Health and Human Sciences. I previously was involved in this study when it was being conducted between UCLA and USC, so I'm very happy to be here.
Okay. We can go to next. Let me just introduce our topic. So our paper is titled, that's kind of like a big struggle right now, is can we get PrEP? Facilitators and barriers to PrEP uptake among active duty gay and bisexual males. Next slide. Okay. So I'll kind of quickly go through a background of this study. And on this topic, last year, the US Preventive Task Force gave PrEP a grade A in effectively preventing HIV. While there's limited knowledge surrounding PrEP access and uptake within active duty military personnel, we do know that there are 350 new HIV infections that are detected among military personnel, and this number is rising, especially among active duty Black, gay, and bisexual men, or GBM. 2017 national estimates indicate that within the military, approximately 4% of male service members identify as gay or bisexual. Based on previous assessments, it is estimated that about 12,000 GBM service members may be eligible for PrEP. However, previous studies looking at military medical records show that those who are prescribed PrEP are usually white, young, educated males within the military. And we've also found that Don't Ask, Don't Tell, which was enacted in 1994 and went all the way up to 2010, this policy prevented LGBT military service members from openly serving in the military. And what we found was that DADT was harmful in that it produced stressors among military gay and bisexual men that led to poor physical and mental health outcomes. They prevented LGBT military from discussing their sexual history with their military healthcare providers, and they reduced the ability of researchers to get accurate information about LGBT military service members. Next slide. So our main study questions are, what is the interest in and access to PrEP among active duty military gay and bisexual men? And what are the perceived barriers and facilitators to PrEP uptake among active duty military gay and bisexual men? And I'll turn it over to Ashley to discuss the study.
Yes, next slide, please. So data from this analysis were drawn from a larger project called the Military Acceptance Project, or MAP. This was a mixed method study that was a collaboration between folks at UCLA and USC, as well as some people at Children's Hospital, LA. It involved a formative qualitative phase with LGBT service members in 2016, which informed the development of a quantitative survey that was disseminated among LGBT and non-LGBT service members in 2017 and 2018. For our qualitative phase, we recruited our sample through an expert advisory panel. This panel was comprised of former and current LGBT service members. We conducted life history calendar, in-depth interviews with the sample to explore physical and psychological health, life stressors, and social support networks that they experienced during their military service. Some service members talked about PrEP within larger discussions of sexual health and military healthcare. So we analyzed that data using structural and descriptive coding techniques to identify experiences with PrEP, as well as some barriers and facilitators to access within the military. Our quantitative component consisted of an online survey. We recruited a sample of LGBT and non-LGBT service members using respondent-driven sampling. So in this approach, we recruited initial seeds through our expert advisory panel and other military contacts of our study team. These seeds took the survey themselves and then shared the survey link with their social network, who were then encouraged to also take the survey and continue sharing the survey with their social network We incentivized up to 3 referrals for each participant. And in the end, we also supplemented our recruitment with digital outreach to military-related social media networks and the digital newspapers for military branches to try to reach folks who might not be out to their social networks as well. And we analyzed this data using descriptive and bivariate analysis techniques. So our online survey assessed interest in having access to PrEP, having ever talked to a military doctor about PrEP, and being able to access PrEP through their military healthcare provider. Next slide, please. In terms of our sample characteristics, in the qualitative phase, we had a total of 42 participants, of whom 22 identified as gay and bisexual males. Of those 22, 10 talked about PrEP, and so that comprised our analytic sample for this study. All 10 participants were white, gay, and bisexual males serving in the Army, Navy, or Air Force. And we had 2 participants who were actually healthcare providers. One was a medical provider and one was a mental health provider. In our quantitative analysis, we had a total of 503 participants, LGBT and non-LGBT. Among those, 114 identified as GBM. And among those, 93 answered our PrEP questions and comprised this analytic sample. Again, they were majority white, largely single. 3/4 had above a bachelor's degree in education, and the median age was about 28 years. Next slide, please.
Okay, so I'll run through our quantitative results very quickly. So the question was that we looked at was the interest in PrEP. And what we found was that about 71% were interested in PrEP. But we also found that the only significant difference between respondents interested in PrEP versus those not interested was their living arrangement. A larger number of participants living off a military base were interested in PrEP compared to those living off base. Among those interested in PrEP, we asked the following questions. Did you discuss PrEP with your military health provider? And a little over half indicated yes. Again, participants who were single and disclosed their sexual orientation were more likely to discuss PrEP with their military healthcare provider. We also asked about gaining access to PrEP and through their military provider. And we found that 48% who were interested were able to gain access to PrEP. And they were, what we found was that those who were younger and discussed their sexual orientation with their military healthcare provider were able to access PrEP more than those who were not. Yes, so I'll switch over to Ashley to talk about our qualitative results.
Okay, so I'll run through these kind of quickly, but we had 4 major themes come out of the qualitative analysis. The first being that providers often presented negative beliefs or knowledge gaps regarding PrEP as perceived by service members. They also discussed the lack of a system-wide approach to PrEP access in the military. We had one service member discuss confidentiality concerns as particularly important, and several touched on relying on peer networks for PrEP guidance and support. Next slide, please. So within our theme of negative beliefs or knowledge gaps among providers, we had several folks discuss personal or vicarious PrEP experiences in which they encountered negative beliefs or stigmatizing and discriminating attitudes or biases when seeking out PrEP from military providers. So as one gay male in the Air Force said, I know a friend who went and asked about PrEP. The nurse was basically stonewalling about it, just said you can either expose yourself to the dangers of HIV or you can go date girls, it's your choice. Several service members also discussed the lack of knowledge among providers, prompting them to seek out other providers or often educate the providers themselves. As one male in the Air Force said, the doctors have no idea what PrEP is and they have to Google it. I have less confidence in the military healthcare providers over this. Not only do they not understand, so then trying to get them to advocate for me or even convince them that I'm a candidate for this is extremely difficult. Next slide, please. Several service members also discussed the lack of a system-wide approach to PrEP access, in that PrEP was often dependent on their location or specific healthcare providers. And folks in the Air Force in particular experienced specific limitations for pilots and aircrew members around getting PrEP. As one service member said, and this person was a medical healthcare provider, who said I would have to essentially talk to my colleagues that I consult with regularly about my sexual health for his own PrEP access, but said my concern is, well, how does that affect everybody else? As another service member said, the big question is whether or not they can get PrEP, even when they aren't specifically barred from getting it, and some have limited success, others can't get it at all. Next slide, please. We had one healthcare provider talk about confidentiality concerns, basically saying in his experience, he'd been passed around from different doctors to the next, and to the military. It appears that their medical history is open for all to have a look at. Sorry to rush through these, but this provider basically was bounced between a bunch of different doctors and felt that his information was kind of open and available for anybody. Next slide, please. So lastly, we had several service members discuss relying on peer networks for PrEP guidance and support. As one male in the Navy said, discussing an online Facebook support group. Someone went in and posted, "This is what the nurse told me," and everybody immediately was like, "Oh, there are all these avenues in which you can complain about this." And the service member went on to report the nurse's behavior because of this support. As another participant said, "Many of my colleagues who either know that I'm gay or know I have some level of experience in treating LGBT service members will come to me personally for their own PrEP access." Next slide, please.
I think why don't I'll, since we are at time, I will go to our future directions just to discuss the need. So what we have seen is there is a need for a system-wide improvement in PrEP, particularly within the military. And we suggest having HIV-related training programs for healthcare providers. We are suggesting strategies for mitigating confidentiality concerns and improving trust among military gay and bisexual men. We also are seeking strategies to address the structural barriers and to increase PrEP research, particularly among racially and sexually and gender diverse men. Gender diverse military service members. Thank you.
Great. So thank you, Raiza and Ashley, for a wonderful presentation. This is really impressive, kind of weaving in qualitative and quantitative. We have a few questions. So I had a question from Felipe, who messaged me directly. The question for both of you, were there any differences in awareness of PrEP between those enlisted versus the officers?
Raiza, I don't think that we found a difference between officers and enlisted.
Okay.
Right.
All right. Thank you. And a question from Dr. Shoptaw. Of the men who didn't identify as gay, bisexual men in the sample, what % reported being men who have sex with men? So of the 400 or so men not identifying as gay, bisexual men, and does homophobia play in accessing PrEP?
That's a good question. I don't think we analyzed those folks not identifying as GBM around their PrEP access. We focused in on GBM specifically. And because those were the only participants in the qualitative interviews that discussed PrEP, we also didn't have any qualitative data for other participants. So at least at this point, we'd only focused in on that part of the sample. But that'd be a great area for future research.
Yeah, that would be good to look into in the future.
Great, thank you. A question from Dr. Norita Milburn. Any more thoughts about how any of your recommendations can be implemented within the context of military culture? Great question.
Yeah. A very good question. Yeah, I think the military environment comes with a lot of its own challenges, and like came up in our presentation, there's a lot of bureaucratic issues to deal with and a lot of hoops to jump through. I don't know if I can speak to what the military can do to improve that, but I think we are in a time of opportunity, especially in kind of the context of the pandemic and what we've seen telehealth do for PrEP access. Potentially there's avenues for the military to leverage some of that innovation as well. And I would hope that with the U.S. Prevention Task Force recommendations and more support in the civilian environment coming for PrEP as well, that would maybe influence some things within the military context. But again, I don't know. It's a really difficult question and a good one. And I think we have Ian Holloway on here too. I don't mean to call you out, Ian, but if you have any ideas, feel free to jump in too.
Ian, would you like to join?
Sorry, I'm unmuting from multiple sources. No, I think you did a great job. One of our co-principal investigators on this study is Carl Castro, who's a retired general from the Army. And he's been working on some policy initiatives. And once his paper is out and we have a chance to disseminate the findings a little more widely, I think we'll take this up through some of the channels that he's already established.
Thanks, Ian.
Thank you, Ian.
Great. So I think, so I got instruction that we have 1 minute remaining, and we probably already had 1 minute, but I just want to, consider one more question from our audience. In terms of the PrEP interest, I think one of the findings was that, those living in the base were not as interested. So any thoughts on why that would be the case? Is it due to lack of education, access, or information?
I'm thinking a possibility is because they're connected to military healthcare providers living in base, that they don't have that kind of need to access it as much as those probably living off like kind of more remote areas, which we found that through kind of literature that remote areas are having a harder time getting access to PrEP, particularly in kind of more rural areas. And so that might be a factor.
Well, great, Raiza and Ashley. That was a really awesome presentation.
Thank you.
Thank you.
So Eric?
Fantastic job. I personally have a bunch more questions, but in the